All right, welcome everyone to today's webinar. This webinar is a part of a four-part webinar series being hosted by NASTAD. Today's webinar will be focusing on PrEP uptake, strategic communications and education. And we have a wonderful panel of speakers from EHE jurisdictions in Florida that will be sharing their experiences with this topic. So just to let folks know, we are recording and we will share the recording as well as the slides with everyone who registered, as well as on NASTAD's website. Please feel free to use the Q&A function or the chat to ask your questions at any time, and we will do our best to answer all the questions as time allows. For any questions that go unanswered, we will ask our panelists to answer those in writing and share those with you all. So to kick us off, I'm going to hand it off to Maria E. Alvarez from CDC to welcome us. Maria?
Thank you, Krupa. Can you hear me?
Yes, we can.
All right, fantastic. So thank you, and my name is Maria E. Alvarez. I do have the honor of serving as the Capacity Building and Technical Assistance Lead within the Program Development and Implementation Branch at the Division of HIV Prevention. So thank you for today's webinar, the second webinar, which is entitled Strategic Communication and Education for Improving PrEP Uptake, will focus on activities for increasing PrEP education, awareness, and utilization through social media, marketing, and kind of provider education. Thank you to the panelists who are presenting. Thank you to NASTAD for hosting just another fantastic technical assistance webinar series. I look forward to supporting all four. Just a quick reminder that CDC remains committed to the provision of technical assistance services. And so we encourage you and your recipients and stakeholders to attend these technical assistance webinar series. If there are any questions, please submit them to the ps20-2010@cdc.gov mailbox. And that's, of course, in addition to Krupa's and NASTAD's mailbox. I'll bounce it back to you, Krupa, just to allow greater time for our panelists. Thank you again and have a fantastic webinar.
Thank you so much, Maria. So we're just going to start out with a quick overview of NASTAD's role in EHE and some of the work that we've already done. And then we'll go into our panel discussion, which will take up most of our time today. So our panelists today are Kara Johnson-Williams, Crystal Kirkland-Mobley, and Marcio Gonzalez, and they will have an opportunity to introduce themselves and share a little bit more about their roles. But just a quick recap of NASTAD's EHE program. We are the National Technical Assistance Provider for EHE planning and implementation. We're also the systems coordination provider through HRSA and are able to provide technical assistance to HRSA-funded health departments. Some of the work that we've already done, we've provided direct technical assistance during the planning and implementation phases. We also work to highlight successes through our EHE Spotlight series, as well as various webinars and briefs that have come out. We do a lot of peer-to-peer learning. We share information about what's going on in the EHE world through various communications, webinars and resources focused on specific topics, and then also partner with various national organizations to provide technical assistance and work on various EHET-related projects. So I'm going to now turn it over to our panelists to introduce themselves, and we will get started. So I will kick it off to Kara to introduce herself first.
Good afternoon, everyone. I'm Kara Johnson-Williams with the Florida Department of Health here in Orange County, so that's Central Florida. I am responsible for a four-county region called Area 7, where we oversee disease reporting, HIV prevention, and EHE activities for Orange County.
Hello, everyone. I am Crystal Mobley. My pronouns, she, her, and hers. I am the HIV Prevention Program Manager for the Florida Department of Health in Broward County. My role in EHE has been to assist with the developing, planning, and coordinating activities and programs for our Broward County EHE efforts. Also in my capacity, I also assist with the development of our EHE contracted services with providers who are providing PrEP clinical services.
And good afternoon. My name is Marcio Gonzalez, and I'm the EHE coordinator here in Hillsborough County, as well as the contract manager for the EHE recipient contracts.
Thank you all so much. So I wanted to start our conversation off today with talking a little bit about social media. Social media is a great tool that can be used to promote a lot of our work. So if you all could each talk about what you have done in your jurisdiction or through your health department as far as utilizing social media to educate the community about PrEP, including any successes that you've had or things that have worked, and then also things that may not have worked.
I would say our most successful venture with social media is contracting with a local social media influencer who has a lot of reach within our area. She currently oversees our Instagram and Facebook pages. She provides a lot of information in terms of HIV testing as well as PrEP, but she's done it in a different way compared to how we were previously just making posts. She created a series called Talk Series. So our main brand is called Talk, Test, Treat Central Florida. And she let us know that one of the things we weren't really focusing on was the talk piece. And that's how a lot of people can engage and learn more about PrEP education on testing and so forth. So she created a series by finding other influencers, but then co-collaborate with them on their pages so it would get more people to follow us who would more than likely never followed us on Instagram or Facebook. And then they're telling their stories in terms of their relationship, in terms of testing, what that looked like, stigma, as well as PrEP services.
Yes. So as DOH employees, we're limited on our social media efforts. So we have a local shared DOH Twitter and Facebook page that allows for a limited number of postings each month. But these social media sites are shared among all of our local DOH programs here at the Department of Health. So for us, we rely as well on our contracted providers to ensure we are getting HIV prevention messages such as PrEP through the social media, through their social media accounts. So the content that is developed and is shared on social media, it's developed solely by these providers. And of course, often they inform and link individuals to the PrEP testing and treatment services at their organizations. The providers have had much success in this by expanding their PrEP programming and reaching new individuals through their postings. And our providers have a minimum amount of social media outreach that they must conduct to stay in compliance with their contract. So we have a lot of social media presence through our contracted providers in Broward.
And over here in Hillsborough, likewise, we have contracted providers who do the bulk of the social marketing because of the limitations here at the health department. But I'll give you an example of one of them, Metro Inclusive Health. They run targeted advertisements on Instagram, Facebook, Google, YouTube, dating applications such as Grindr, Scruff, Jacked, which are generating over 45,000 impressions each quarter, along with also reaching adult sites through Traffic Junkie, which that's probably where the bulk of the impressions are generated, over 800,000 impressions each quarter. Another provider, Midway, they're contracted, but besides the usual Instagram and Facebook, they really try to focus on one-to-one conversations through the dating apps, which has yielded great results, heavy on the testing and PrEP. Metro has also provided widely broadcasted commercials to address testing normalization and stigma reduction, PrEP education, and typically that reaches around 70,000 households. That's so far this year in 2023, it's reached over 70,000 households, and that's most part through Hulu and YouTube.
Great, thank you all so much. So a follow-up question. First question for Kara. How are you all able to utilize your EHE funding in terms of the social media influencer?
So we actually contract with her to provide that service. We already had a social media platform started, and she was able, we've given her access as an admin to do the posting, to be responsible for all of the follow-up, any DMs that come through that ask questions about where you can go. And she really sort of upgraded us, because even adding the LinkedIn tree and all those things that we really never would have thought of doing, she did, because she let us know, like, if you really want people to reach you, or I should say, you got to think social media is quick, fast. You got to be to the point. So she was like, these are certain things that need to be done. So we specifically took our EHE funding and contracted with her, came up with a set of deliverables that she would have to meet on a monthly basis, and it's been a huge success so far.
Great, thank you. And for Crystal and Marcio, for the organizations that you all partner with or have contracts with, were there specific things that you all wrote in terms of what messaging needs to be included, or any sort of like requirements to help folks make sure that they're including all of the things that you would like to put out there?
So for Broward, we don't tell them the message just must be a testing or prevention message, of course, because it's a prevention contract. And they have to post a minimum of 4 times a month. So that's the only stipulations that are provided through their contract, that it must be a prevention related message, and then they must post a minimum of 4 times a month. And of course, we're able to see the demographics of the individuals they're reaching and the impressions and all of that data when we are visiting for their contract monitorings, but those are the only requirements that we have.
And I would say the same here. We don't put any limitations on the verbiage or the actual message, but again, along the lines of prevention and treatment, and depending on the funding and their capability as far as analytics, sometimes if they do have more funding and they have the capability to provide more detailed analytics, we will write that in the contract as well, so that we can get a little bit more information as how effective the marketing reach is.
Great, thank you. So kind of switching gears a little bit, but still talking about what strategies you all are using. Are there other marketing strategies that you're using, such as dating apps or outreach events, or anything else that might be considered kind of outside of the box?
So for our contracted providers, for their outreach activities that's contracted in, they are expected to provide PrEP messaging and PrEP education. We also do like our traditional advertising through like radio ads, billboards, whether that's print or digital. But we've also been focusing on streaming and developing videos that's like geared towards the priority populations that we're trying to reach. And the streaming has been really successful because you can really geofence it down to what zip codes you want to provide the message into. And we've seen like direct correlations with requests of home test kits because of those videos. So I think while the traditional forms of radio and billboards are great just to be seen and to be heard, I think by utilizing the streaming piece, that actually has like a return back on the investment, because you're able to see. And through our home test kit request, we ask the question, how did you find out about it? So one of the things is they'll put in, oh, I saw this ad on so-and-so. And then that way we are knowing like how they're finding out that information.
Yes. For Broward, our PrEP campaign, as far as educational awareness, we utilize billboards, including mobile billboards, radio campaigns as well. And through our radio campaigns, it links them to our website to order in-home test kits. We utilize local newspapers to include LGBTQ newspapers, and they also do some social media marketing and posting as well. We have utilized the aerial flight banners where they go over the beach during key times where spring breakers are present, where they have our PrEP messaging, community events such as concerts, health fairs, conferences, all to provide education and awareness. Our staff attends no less than 4 community events a month, and all of our messaging and branding, even the t-shirts that the staff wears, mentions get PrEP, 1 pill a day or 1 injection every 2 months prevents HIV. So all of our marketing materials, promotional items that we distribute have that messaging. Other strategies we're using is to educate our buses. We use advertisement both inside and outside the bus. We have buses that run through our priority areas that our data shows that are heavily impacted by HIV, and we have the PrEP messaging that's running through that on the buses. We do some advertisements and marketing at malls. We have the retail frames at local businesses and gas stations that give PrEP messaging. We are also distributing PrEP materials to over 150 local businesses that we partner with through our Business Response to AIDS initiative, and that's on a monthly basis. So because we have limitations with the social media posting, we have definitely developed a robust marketing campaign that reach people where they live, work, and play through our marketing efforts outside of social media. We have rebranded our website. So our website is getprepbroward.com. And this website includes information on PrEP. And also we supply our contracted providers with the promotional materials that we purchase, and also the palm cards and the various educational materials on PrEP that we purchase. We provide it to our contracted providers as well, so that they can distribute it to their patrons as well.
Yeah, we do some of the same using, the billboards and distribute the educational literature to our CBOs. A lot of the EHE recipients that are under contract, they are contracted to provide outreaches monthly. And a lot of the outreaches is they utilize mobile units, and they'll go out to University of South Florida, University of Florida, Hillsborough Community College. They go to local parks, campgrounds, bars, clubs, lounges, beauty salons, barbershops, you name it. They go everywhere. They have focus groups. They're at the Pride Parade, of course. And in all these outreach events, they're providing PrEP screenings, free testing, the PrEP literature, and really, with the attempt of getting the messaging out there. One thing that one of our providers do on every second Tuesday of every month is what they call the Test, Talent, and Trivia Night. And that's hosted at a local lounge. And they have beauty pageants. They have the yearly Mr. and Miss PrEP for Life pageant, where over 300 members were in attendance. Many were tested for both HIV and Hep C and received educational material for PrEP. So a lot of the work is done in the community through these type of outreach events.
Great, thank you. There were a few follow-up questions in the chat. The first question was, social media can be effective, but paid outreach is expensive. How are you all dealing with the costs, and what plans do you have for sustainability?
They're right, extremely expensive. So what we've done, and because I've worked with some of these people for a good amount of time too, even prior to EHE, I let them know like, hey, this is what I have. This is what I would like to achieve. And because it's been like ongoing business with them, they've been working with me. Now, I can't say that everyone will get that. Also, I tailor it around like National Observance Days. So like your National Testing Day, Women and Girls Day, World AIDS Day. So I'm like, if I can get all 3 of those for a package of this, how can we work together on that? And it's just really networking at the end of the day. And a lot of them, they're willing to work with you and just being transparent and saying like, hey, our funding is limited, but we really want to be able to provide this reach and really utilizing those media companies too to learn more about what we're doing, why they can help, and being of an importance to it. So it's worked for me for like the past 3 years in terms of that. But again, I've been working with some of these people for a while, so I guess it's sort of say I'm good for it. So they've been doing that.
Similar strategy here, leveraging our partnerships that we already had established, and identifying ways that we can continue the work. So the similar strategy of utilizing, focusing on times, grouping awareness days, activities together, using that. So planning out a whole year, even when it comes to the billboards, the mobile billboards and all of those things, of course, it's extremely expensive trying to run that throughout the year. So we look at the actual times, awareness days, times that we want to display those things. And then we also switch it up. So if one quarter I'm doing mobile billboards, the next quarter I'm doing this. So that it's constant PrEP messaging out in the community. And then also, like I mentioned, leveraging community partnerships that are already established, leveraging some non-traditional partners, incorporating some PrEP messaging into the activities that they are already doing. Especially you have organizations that is not doing anything with HIV related services, but they have another service that they're providing, contacting them, providing them with some of the branded materials that you have in educational pamphlets. So we use outreach in those efforts as well. In addition, we utilize our current staff that we have as well to do some community outreach. So relying on our community partners, but also utilizing our internal DOH staff and other programs that go out in the field as well to provide this PrEP messaging with us.
Yeah, and this will probably be my first year really tackling this. It seems like it has been an issue, but later on this month, the HIV/AIDS program office are set to meet, and we're looking how we can be very strategic, similar to what Kara and Chrissy have said about the timing of different events and just working on the calendar and really calendarizing, I guess you could say, and being very strategic. And working together, looking at the different buckets of funding and how we can just work more of a team instead of individually, just EHE or whatever, how as a team, we could be more strategic with the funding.
So kind of a follow-up question, how do you all decide which social media platforms to use?
I saw that he mentioned he's still on MySpace.
Yeah, definitely not MySpace, but I'm familiar with that. But I would say initially when I first started looking into like social media and advertising and stuff, for like the price range that I had, they would say you would get the most for this. So just having those conversations with those experts and just saying like, where can I get the like biggest reach? And then trying to zero that down to that. So I really rely on like those media partners to give that advice because that's not within my expertise. But then, they've been very helpful to say like, well, you can do this, but you can also add this piece in instead of just putting all of your funding into just one source when it comes down to social media. So I sort of rely on them to give me that advice.
And it's similar with us and with our contracted providers. Our contracted providers are going to utilize the platforms that's going to give them the biggest bang for their buck. So they're definitely utilizing those platforms. And in regards to the newspaper, any media company or newspaper purchase that we do, and social marketing is a part of it. We rely on them to determine which platform that they're going to utilize. We just provide the priority populations and the demographic information that we're trying to reach and what our budget is. And then we rely on their expertise to identify which platform is going to help us reach our market and get the message out to the individuals we need to get the messaging to.
Likewise, we tend to lean on the experts when it comes to social marketing. There's a lot of platforms out there. There's one that's, I think it's called Run with Commando. And Commando is it's a platform that assists organizations to maximize a variety of platforms. And there's all kind of analytics that will help assist them to figure out, where they're going to get the most bang of the buck. And I know at least 2 out of the 3 of our contracted providers uses Commando as that platform. And it's been, one of them just started a couple months ago, and she was showing me some data of how it's really bringing in clientele. And it's very well targeted. They do all the work for you. And so it does save them a lot of time as well.
Great, thank you all. There was another question. Someone had mentioned adult sites. If you could clarify what you meant by that, were you talking about like adult entertainment, or were you referencing something else?
Yeah, I've never been on those sites. So I can't tell you exactly which sites. I haven't seen the advertisement on that particular site, but yes, it's through Traffic Junkie, and it does go through some of these adult sites, and it may come out in the form of a banner, where on that banner there'll be an advertisement with a link, and it could bring you to a site where it'll have information for as far as testing or education. And so yes, indeed, it is an adult site.
Great, thank you. And then there was also a question if you all are willing to share your Instagram, Facebook, whatever platforms you're using, if you're willing to share the links to those accounts. That would be great. You can share those in the chat. So I wanted to talk a little bit about some of the partnerships and contracts you all mentioned. Have there been any new contracts or partnerships that have come out of this work? Non-traditional partnerships or folks that we normally in public health don't work with?
I would say a lot of like our grassroots agencies and even local businesses, because they may have seen like an ad or something. It's like, oh, well, you can bring in, pamphlets inside of my store. It's a guy that we've done a lot of work. We're actually doing a back to school event with him on Saturday. But in his restaurant, he allows us to play our PrEP video throughout the day. And he was just like, if I can educate somebody through my own platform. So it's just like really finding those partnerships that traditionally wouldn't be working with DOH, but because of a lot of the advertising, they've said, okay, I want to be a part of this as well. So that's really been really successful for us. And then we've done like some pilot projects with some grassroots agencies, and they've had a huge reach in terms of education and even actually getting individuals on PrEP who traditionally wouldn't be even knowing what PrEP is. So we've actually started like a mini contract with that provider because of the success that they were able to show.
Through our marketing efforts, we've been able to expand our physician detailing program with private physicians and develop new partnerships with non-traditional practices coming on as HIV registered test sites and or condom distribution sites, which of course always includes the PrEP messaging as well. That's how they found us through our PrEP marketing efforts. We also have some partnerships with non-traditional partners, such as adult venues, the entertainment clubs and the bathhouses and sex stores and stuff as well, where they're distributing in-home test kits and also PrEP educational materials to their patrons. And they connected with us through our marketing efforts as well. So definitely we've been able to expand our community partnerships with partners that we typically didn't reach in the past through our PrEP marketing.
We've been able to make some partnerships a lot through, we began a monthly meeting called the Hillsborough Community Planning Committee. And in that meeting, we've been inviting other CBOs, other business partners in the community. And we've partnered up with a lot of barber shops where we're able to distribute condoms and PrEP literature, leave it there at barbershops, beauty salons. The local school board, we just made a partnership with them and we hosted a meeting there on their location. A behavioral health location, it's called Cove, it used to be called DACA. They're also working with us. yeah, as well as faith-based organizations that we've also partnered with. One particular faith-based organization that has a wonderful daily feeding program Monday through Fridays, and have allowed us to set up free testing sites where the volunteers from the STD clinic, they actually have these T-shirts that says "Get prepped, play safe." And so we'll go out there and they'll be doing HIV testing, and we'll have a table set up with PrEP literature as well.
That's really great. And Crystal, I know you mentioned providers. I'm going to come back to that a little later, but I had a couple more questions I wanted to ask you all. So in terms of, with EHE, there are populations that are priority populations. So with the work that you all are doing, are there specific populations that you all are trying to reach in terms of PrEP? And if so, what are the things that you're taking into consideration to make sure that those populations are being reached?
Yes, so one of our priority populations is specifically Black women, because in our area, they're 10 times higher compared in terms of rates compared to their white as well as Hispanic counterparts in contracting HIV. So I was just like, okay, what can we do to address that? And even in the town halls that we've had in the past, many of those women said, well, we didn't even know PrEP was something that was available to us because the ads don't even look like us. So I was like, okay, that's deep. So how can we address like that as a whole? So we partnered with one of our local prevention contracted providers, and they had a campaign called She's PrEPalicious. We provided funding to help support that initiative. And then we started a series of billboards as well as Instagram ads and Facebook ads that directly led to their page in terms of, because she hosts a lot of women events as well as education specifically towards Black and Hispanic women. So I was like, okay, this can be like a 2-for-1, because then that way they can be educated on it as well as have some follow-up and to learn about how to get on PrEP. So that's one of our campaigns as an example that has been a huge success.
As with any activity we implement, it's going to be data driven. As Kara said, it's the same thing. Our data shows that Blacks are heavily disproportionately impacted in Broward HIV. So one effort we implemented locally was a partnership we did with the movie advertisement company. And that was to have on-screen movie ads prior to the film being shown, on-screen movie rolling ad that prioritize Black women in PrEP. It had PrEP messaging on there, and it was solely for Black women. These ads were shown, as I mentioned, prior to the movie, and linked them directly to our Get PrEP Broward website. The locations also that we select for all of our marketing efforts are based upon the populations that our data shows we need to prioritize. So we ensure that when we're doing the billboards and the retail frames or the malls that we select, is definitely reaching the populations that we need to reach.
We also have been trying to target Black and Brown women, and two of our EHE contracted providers, they host monthly meetings. One, I believe, is entitled WOW, World of Women is what it is. And they'll have a monthly meeting, and they had a Gilead rep come and give a educational course on PrEP. And then this month, and Community Health is having they're dedicating this month's monthly group to PrEP as well. Besides that, we've also been trying to do more with the younger generation. And so our contracted providers are also contracted to equip and train youth peer advocates and what they call like HIV ambassadors. And so they also have these sort of youth groups where they'll meet and they'll have food and they'll have a game or icebreakers, but then they'll have these conversations and try to equip and train these young HIV ambassadors to reach their peers.
Thank you. That's wonderful. So switching to what we all struggle with, the different challenges with raising awareness about PrEP and promoting PrEP. So what have been your biggest challenges in getting out information about PrEP in your communities?
I would say surprisingly, our largest challenge is not only that individuals not knowing what PrEP is, but then even our providers, primary care, internal medicine. And I don't know if it's that they don't know or they just don't feel comfortable in prescribing, because once it's broken down to them, how simple it is and how it can be like instituted within their practice, then it's just like, well, shouldn't I go to infectious disease provider? Like those type of things. So I don't know if it's that they don't know or just the willingness to do it. But that has been a challenge for us. We do have a provider detailing team that goes out and provide that messaging and education. And we also partner with some of our pharma reps. So they host the dinners and to be able to provide the education. And then, we do some of the follow-up, but it's still somewhat slow to get those providers to like actually start that process. Some of them have, and even advertise it like on their sites and stuff, but that's just really far and few.
One of the challenges for us will be the limitation we have on the social marketing platforms, because social marketing is essential. Everyone is on it all times throughout the day. And to be honest, it's less economical. It's more economical than some of the other strategies of purchasing billboards and all of the other things and buying materials. So the limitation of not being able to fully utilize the social media platforms as marketing tools has been one of the challenge for us. We do have a physician detailing program as well. And the same, you have some providers that just are not knowledgeable on PrEP. They're not doing sexual history screenings and different things with their patients in regards to promoting PrEP. So that will also be one of the challenges that we have that we're addressing through our physician detailing program.
And I will concur. We're having some of the same issues here. I recently spoke to a drug rep who said that on multiple occasions she was thrown out of an office, and they explained that they just simply didn't have time for her to go through a whole thing on sexual health. And one of the things that they mentioned was something that has been prioritized, and I think this has been since COVID really, is mental health has sort of taken the forefront. And so if they only have 15 minutes to work with a client, if they're going to talk about something, it's going to be more along those lines than sexual health. And I've heard that a number of times, and I get it, but I don't know. I think that's definitely an issue there. And then the other thing, also, social media, we have that limitation here in Hillsborough County as well. But however, with PrEP, I think even if we did have our own Instagram or Facebook, I don't know how many followers we would really have. So doing what Kara's doing over there with getting a influencer, I think is the way to go. And so I think that's thinking outside the box creatively.
Thank you. So all three of you mentioned, challenges with providers. So can you talk a little bit more about, what are some of the challenges, and are you all in your provider detailing or outreach that you're doing? Are there specific types of providers that you're starting with, or, what is your strategy for that?
So we started with the providers that we saw through surveillance data first. Then we ended up sending out, because we partner with our EPI partners, because they send out messaging to providers through mass faxing and emailing. You would see that they will open it, but then did they actually read it? That's a whole nother thing. In addition to that, with the providers, even getting them to know that routine screening is something they should be doing. that's, I mean, because you can't even talk about the PrEP piece if they're not even doing the routine screening. Some of them, even my own doctor, I've had the conversation with them and I was like, oh, you didn't check the HIV box on my labs. Oh, and then they go into panic. And then I'm like, hold up, you don't have to do that. And then I'm going through the process of trying to educate and explain to them how many more doctors, you know what I'm saying, are in that place where they don't feel comfortable doing sexual health assessments, making assumptions that certain people don't need the test. Like it's a whole thing. We're moving a little bit further, but it's still sort of discouraging to a certain extent because some of these things should just be just automatic and routine. Granted, our hospital system is moving towards that, but like a lot of people still see primary care and internal medicine providers. So, and even your OBGYNs and stuff, why isn't that going on?
And for us in Broward, we visit over 100 physicians a month. We have a physician detailing team that reports to me that they have a list of physicians that they visit on a monthly basis. They talk about routine testing, they talk about PrEP, and then we also talk about our test and treat program as well. So through those efforts and the toolkit that we provide them, it talks about sexual history. We give them PrEP billing and coding, cheat sheets and everything in regards to that, and education materials that not only that they use for their office, but they can also distribute to their patients on PrEP. But also we tell them too, if you're not ready to prescribe PrEP and this is not for your office now, here's the information to the community resources in the area who's ready to prescribe PrEP. So we utilize our PrEP palm cards that links them back to our 24-hour PrEP hotline. So if they hand that PrEP palm card to a patient, if they're not going to prescribe it, link them to somebody who will prescribe that. So we do that through our physician detailing program that we have.
Here at the health department here in Hillsborough County, we'll have monthly what they call lunch and learns. And so they'll invite community providers to these lunch and learns. And every month will be something different. They might talk about topics regarding sexual health. It might be about diabetes. It might be about, a whole array of things. And some of them have been regarding PrEP. I think some of the issues that we have with the providers is we need to have a greater presence in the community with our providers. A lot of them are willing to refer clients when it comes to, when they bring up PrEP or they're interested in PrEP. They may not really want to have that conversation with that client, but they'll be glad to refer them. However, there is that issue where some of these clients may, live quite far in the southern part of Hillsborough County, and transportation then becomes an issue. The good thing is some of our providers do offer Uber Health, depending on the radius and how far these clients are. That's one thing that they try to relieve. So I think just building better relationships with the providers and trying to think outside the box and kind of be more collaborative with them and see where we could come alongside. And so where there's shortcomings on their end, how can we kind of come up and support them?
Thank you. I think everything that you all said probably can resonate with a lot of folks on the call today. So I know, there's so many challenges when it comes to provider education and awareness around PrEP, but I'm wondering if you all have had any successes as well.
For those providers who've been willing to be participants, they've maintained that. So I see that as a success because, they could easily say, and granted, the referral process, being a provider that is willing to refer out clients, that's great. But my issue with that is some clients, they may be ready at that moment. And then tomorrow when they're getting referred somewhere else, they may change their mind. But at least for the providers that have signed on, have continued with those processes and made it as a routine process within their clinics. Some of our educators who've gone out, showed them different ways of, as Krista had mentioned, like the ICD-10 codes, those different things to make them feel more comfortable with that. So I just feel like, at least with those that have started, they've maintained it.
some successes for us. It's been the same as Kara's shared. We have some providers who have signed on, some primary care OBGYN providers who have signed on to be PrEP providers. They took the education that we provide. We were also able to link them to some additional resources out in the community, rather than being a pharmaceutical rep who could provide additional information, or another physician who's also prescribing, where it's peer-to-peer. So there's been some successes in that we've been able to maintain our physician directory with these PrEP with the physicians who are who said that they're ready to prescribe PrEP and they're knowledgeable on it and they can do the sexual history and they incorporated routine testing. So that's been some successes we have seen through our physician detailing efforts.
And for myself, I really don't know outside of providers that are contracted under EHE, so I could only speak to that. But those who are have been doing really well as far as meeting their requirements on what's on their contract, and fulfilling those requirements on the deliverable. So we've been happy with the contracted providers under EHE.
And do you all see any of the providers that you all are working with now perhaps being champions for PrEP in the near future or later on at some point?
Some of them have, and they've also been a little more involved with like our quarterly partner meetings and seeing how they can be involved, even with the whole process of if they have someone who is diagnosed with HIV, like being a champion to making sure that they get linked into care, that they're actually reporting those cases. So they've been a champion all around, not just on the PrEP.
And with us, because we started with individuals that, some physicians when you enter don't even think HIV is still a problem, so because we're dealing with new physicians, that's our goal. We started with educating primary care physicians and visiting OBGYNs to have this discussion with them. So because that, we're hoping in the future some of them become champions, but we're definitely constantly providing resources, constantly going to visit them on a quarterly basis to see where they are, what do they need from us, so that we can develop them into being this champion, getting them involved in our planning council work groups and more of the community groups that we have, so that they can become knowledgeable on all things when it relates to HIV, understanding that throughout their career, sometimes they only have to do a limited one course a few years on HIV, so they don't really understand the full epidemic. So providing those resources to them over this relationship that we're establishing, we're hoping to develop them into being some champions in the future.
Yeah, and I agree. I think I've already seen a couple that have really shown the passion. One in particular that works specifically with youth at the Ybor Youth Clinic with USF, and that runs into other issues when you're working with a younger age group. But there's definitely been a couple providers who you could see it. They push it in their staff. They're organized. They have a strategy. And so I definitely see in the long run, and understand that working with PrEP is more of a marathon. It's not a sprint. And there's a lot of work that's being done now, just getting the soil ready and getting education out there. But they do have their sights on that goal. So for sure.
Hey, thank you all so much. So we're getting close to our time. I do want to just remind folks, if they have questions, feel free to use the chat or the Q&A function to ask any questions. But for our panelists, what advice or recommendations do you have for your peers for advancing PrEP-related activities?
I would say having like a tiered approach. One, listening to what the needs are of the community, from the community, working with partners who are those grassroots organizations, but also have like their hand with the community, providing those resources and then providing like that connection with them. And then the last thing I would say with those contracted providers, having expectations to continuously provide the education, also being able to link those individuals who they educate into services so they can get PrEP.
Yes. To add on that, I would say flexibility and accessibility have really assisted us in establishing meaningful relationships. Offering wraparound services. Yes, we go in, we talk about PrEP, or we talk about HIV, but also talk about, you know, the other resources that are available, STD or WIC, because some of their patients may have, or the clients that they see have other concerns other than HIV and accessing PrEP. So getting their buy-in by offering additional services, knowing that these services are in addition to the whole health of the person, personalizing conversation, being reliable, just don't show up around awareness days, show up, offer resources throughout the year, call them, offer virtual services. If they need anything, they can call you into the office. So that's been very helpful for us and will be a recommendation that I provide.
I would say a few things. For many of the clients, you know, it's about risk perception. And I would say, you know, stay committed, continue to build that trust and that rapport with the clients. But the messaging needs to be done in every event, regardless if PrEP screenings are being done or not. I mean, when 1628 forms are being filled out, we should take advantage of that opportunity to talk about PrEP and educate the client. I think that'll really help get the conversation started, not only with that, but help with the word of mouth in the community. The other thing is I think that PrEP navigators are crucial. One of our clinics was expressing that they were experiencing a sort of collapse in care once the client moves into and becomes a patient. They're now in the hands of the clinical staff. Not that that's a bad thing, but they sort of move away from case management at that point. And so they're trying to work on correcting that, but that might be an issue with a lot of our clinics where there's no real navigation. And I do think PrEP navigators are crucial. And also providers who've been resistant, you know, they might be willing, you know, to again, collaborate in some sense. You know, they could post, if you're running a free testing event, you know, they might be willing to go ahead and post an advertisement for that event in their offices. You know, even though they're being hosted by other organizations, they might be willing to partner with other, you know, community-based organizations. So let's just stay committed.
Thank you all so much. Just want to give you a final opportunity if there's anything else you'd like to add, anything you might have thought of after the fact. We have a few minutes, so just want to give you that opportunity to share anything else you might want to share before we close out.
That's pretty much all that I had. Just please follow us, Talk Test Treat TFL, Instagram and on Facebook. Also our website, www.talktestcfl.com. I know I sound like a whole plug, but the more people that we can get to follow us, it would be much better. But thank you for the opportunity.
I'm going to plug our website as well. So getprepbroward.com for us. And I think I said everything as well. But if any additional questions that comes up, I'm here. My contact information they will have. But if you can visit our website, getprepbroward.com, and take a look at the resources we provide to our community here in Broward.
I wish I had a book or something that I authored that I could put a plug in there, but I don't have that, and I don't have a website. But I do want to thank you, Cooper, for inviting me, and appreciate you. Thank you.
Thank you all so much. So I just have 2 more slides before we close out. So just want to let folks know that our next webinar in this webinar series will be on Thursday, August the 3rd. From 2 to 3 p.m. Eastern, 11 to 12 Pacific. So we will be sending out information on that webinar. I'm hoping next week. And then please do reach out if you need technical assistance. You can submit a request directly through CDC's CTS system, or you can also reach out to us here at NASTAD. I'm going to put these links in the chat. Feel free to also email me directly if you have any questions about any of the TA that NASTAD provides. We're happy to always answer questions, as well as pass you on to, or, do a warm handoff to other TA providers that may be better suited for whatever your request is. So thank you so much to Kara, Crystal, and Marcio. Thank you all so much. And thank you all for joining. Thank you to CDC for their partnership. And we hope to see you all next time. When you close out, you'll get a quick brief survey. Please do fill that out and let us know what you thought of today's webinar so that we can use that information to improve our next webinar. And as I mentioned earlier, we will share the recording and slides from today via email as well as on NASTAD's website. So thank you all. Have a great rest of your day, and we will see you next time.